Initial or Monday, Thursday sterile line setup for venous lines. IV fluid change supplies. Ordered fluid, procedure cart, Sani wipes, sterile drape, surgical cap, mask, 2 pairs of sterile gloves, clean gloves, hand sanitizer, 1 sterile 10 ml normal saline flush, 30 ml IV syringe for TPN infusing less than 2 ml, or 50 ml IV syringe. 2 4x4 gauze sponges, 2 2x2 gauze sponges, 1 alcohol pad. Label, lipid tubing, medication tubing, TPN tubing. Perform hand hygiene. Don surgical cap. Don mask. Don clean gloves. Ensure other occupants in the room don surgical cap and mask. An independent double check by 2 nurses will be performed when hanging any new intravascular solution. Check type and contents of solution against provider order. Clean top surface of procedure cart with Sani wipes and allow 3 minutes for area to dry. Clean Medfusion syringe pumps with Sani wipes and allow 3 minutes to dry. Remove gloves and discard. Perform hand hygiene. Don clean gloves. Place TPN bag and lipid syringe on one side of the procedure cart. Carefully open sterile drape and place on the top of the procedure cart, ensuring that the top side remains sterile. Carefully open sterile supplies and place them individually on the sterile field. Open the top of 1 sterile 2x2 gauze packet and place it near sterile field for future use. Remove gloves and perform hand hygiene. Don sterile gloves. Access the TriFuse on the TPN tubing. Connect medication tubing to 1 microclave on the TPN TriFuse. Place sterile 10 ml NS flush on medication tubing and prime entire line. Clamp medication tubing. Connect lipid tubing to the other microclave on the TPN TriFuse. Connect IV syringe on the dual check valve microclave on the TPN tubing. With one hand, use a sterile 4x4 gauze to lift lipid syringe and hold syringe. With the other hand, use a sterile 2x2 gauze to remove cap from lipid syringe. Discard cap and use 2x2 gauze. Connect lipid syringe to lipid tubing, prime entire lipid tubing using sterile 4x4 gauze. Place lipid syringe back on non-sterile surface. Discard gauze. Clamp lipid tubing. With one hand, use sterile 4x4 gauze to hold TPN bag. With other hand, use a sterile 4x4 gauze to remove cap on TPN bag. Spike TPN bag with dispensing pin on TPN tubing. Discard cap and gauze. Draw TPN into IV medication syringe. Disconnect IV syringe. Remove excess air and reconnect to dual check valve. Prime TPN tubing by pushing plunger on syringe. Clamp TPN tubing. Keep cover on tip of tubing to maintain sterility while entering patient environment. Once all the tubing is connected and primed, cover the tip of the tubing by placing it in a sterile 2x2 gauze package. Prepare patient IV access for tubing connection. Place 2x2 gauze near patient access to prepare for sterile tubing connection. Perform hand hygiene and don sterile gloves. Gather sterile gauze and alcohol swab to connect TriFuse to the patient access. Use sterile gauze to disconnect expired tubing. Vigorously scrub microclave with alcohol on patient's IV access for 15 seconds and allow to dry for 15 seconds. Sterilely connect new IV tubing. IV fluid supplies for additional IV drips. Ordered fluid, procedure card, Sony wipes, sterile drape, surgical cap, mask, 2 pairs of sterile gloves, clean gloves, hand sanitizer, 1 sterile 10 ml normal saline flush, 1 30 ml TPN infusing less than 2 ml, or 50 ml IV syringe, 2 4x4 gauze sponges, 2 2x2 gauze sponges, 1 alcohol pad. Label, lipid tubing, medication tubing, TPN tubing, Y extension or bifuse, triple leg extension or trifuse. Connect TPN to TPN tubing. To 1 TPN trifuse port, connect to Y extension, 1 port for IV medications and 1 port lipids. To other TPN trifuse port, connect to Y extension for IV medication drips. To infuse IV fluid bags, use single lumen tubing, indicated by red clamp. To piggyback additional fluids to TPN and lipids, connect TPN to TPN tubing. To 1 TPN trifuse port, connect a triple leg extension, 1 port for IV fluids, 1 port for medications and 1 port lipids. To other TPN trifuse port, connect to Y extension, for IV medication drips. For patient going to MRI, connect 3' medication tubing to trifuse, then connect to the patient. An independent double check by 2 RNs will be performed when hanging any new intravascular solution. Check type and contents of solution against provider order. Primary RN and second RN. Scan IV fluid labels and verify correct patient, correct route, correct fluid, correct IV rates, and lines are connected properly and unclamped before signing MAR.